We often think of hair thinning as just a harmless part of aging, something to accept, not question. But we reversed hair loss in a 68-year-old woman from this to this. And in this episode, we'll explain exactly how you can do it too. Welcome back to the Senior Health Podcast, where experience meets evidence, and we uncover the truths that help you age with power, not passivity. Today, we're exploring the real reasons behind hair thinning, hair loss, and scalp sensitivity in older adults, and what most seniors miss about them. According to a study published in the Journal of Clinical and Aesthetic Dermatology, over 50% of women over 65 experience significant hair thinning, but only a fraction receive proper evaluation or treatment, leading to delayed diagnosis and unnecessary shame. And sitting across from me today is someone who's seen this pattern unfold through every decade of modern medicine and still treats patients to this day. Dr. Shigeaki Hinohara is Japan's oldest practicing doctor, over 100 years old, walking daily and guiding thousands with the wisdom of both science and tradition. His perspective isn't just rare, it's earned through a century of paying attention to what most of us overlook.
Thank you, John. It's always a privilege to be here. But let me ask you something. Why do we treat hair as a cosmetic problem when in older patients it's often a medical one?
I think it comes down to habit. We grow up thinking hair is all about appearance, style, beauty, and vanity. But when it starts changing suddenly, especially after 60, it's usually not just a cosmetic thing. It's your body's way of whispering that something deeper might be going on.
Exactly. And hair loss in seniors is more than just a mirror issue. It can reflect what's happening deep within. I've seen patients misdiagnosed, given expensive shampoos or laser caps, when the real cause was a simple deficiency or a hormone imbalance. We blame age far too quickly, and that steals the chance for recovery. So in today's conversation, we'll walk through 4 overlooked causes of hair problems in older adults, and the most natural, effective ways to support your scalp without risky drugs. We'll cover how internal deficiencies show up on your head, how rice water and cumin can soothe the scalp, and how dermarolling, when done safely, might actually reactivate dormant follicles. Stick with us to the end, and you'll walk away knowing what to try, what to test for, and what to stop believing.
So the symptoms might be real, but if we miss the cause, we misread the solution.
Absolutely, John. If we treat hair loss like a beauty issue, we'll miss the healing opportunity hiding beneath it. We'll walk through 4 root causes and 4 ways to support your hair from the inside out. It's not just about looking better. It's about aging with clarity, strength, and confidence.
That really hits home for me. And actually, after hearing you speak, it brought back a memory. I remember visiting my mother one winter. She was 81 at the time. Still active, still hosting Sunday dinners, still stubborn about doing everything herself. But when I hugged her, I noticed something different. Her once thick, wavy hair felt fragile, thinner at the crown. I asked her about it and she brushed it off like most do. It's just age, John. But something didn't sit right with me. We ran a few basic tests, and it turned out she was severely low in vitamin D and ferritin, 2 things that silently rob the body of strength. Within months of correcting them, her energy came back, and so did the texture of her hair.
That's the quiet danger. When hair changes, it's often the first whisper that something deeper needs attention, and if we wait too long, the body may begin to shout.
So let's start with what many seniors, and even doctors, overlook: how simple deficiencies can quietly disrupt hair growth before any symptoms show up on paper.
Hair doesn't fall because it wants to. It falls because something within has gone missing. The scalp is one of the last places the body chooses to nourish when nutrients are low. The priority always goes to the heart, the brain, the essential organs. Low vitamin D3, iron, ferritin, B12, even mild deficiencies can starve the follicles quietly for months before hair loss begins. And when it starts, most people reach for a shampoo instead of asking, "What is my body trying to tell me?"
That's striking. The idea that hair loss is more of a late warning signal than an isolated problem. It reminds me of how many seniors are told their labs are normal, when in reality they're just at the very bottom of the range. Are you saying we should be looking beyond standard reference values?
Absolutely. What's normal for a 30-year-old may not be optimal for someone at 70 who's had a lifetime of nutrient depletion. I often look for what's ideal, not just what falls within a wide lab range. Hair is often the first place we see the consequences of subtle imbalances long before they show up as disease.
That changes how we think about prevention entirely.
Yes, because when we wait for a crisis, we've already lost ground. But if we respond to the earlier signals, like thinning hair, we can restore more than just appearance. We restore function.
And that's the part that's often missed. Hair loss feels like a cosmetic concern, but for many seniors, it's a doorway into understanding their deeper health. Let's talk about that next. The ways simple foods and time-tested traditions like cumin or rice water can support the scalp before damage sets in.
Cumin is one of the most underestimated herbs in modern health, especially for the scalp. Its oils contain anti-inflammatory compounds that calm irritated skin, and it's rich in nutrients like iron and zinc that support follicle activity. Used topically, a paste made from cumin powder, lemon juice, and coconut oil can clear dandruff and soothe chronic itching, both common in seniors. And consumed regularly, even just a pinch after meals or as tea, it begins to work from the inside, where the real healing starts.
That's fascinating, especially because most people think of cumin purely as a spice, not medicine. I've seen patients respond better to 1 week of gentle, herbal support than months of medicated shampoos. Do you think people underestimate the power of these everyday ingredients because they seem too simple?
Yes, and sometimes simplicity is what makes something sustainable. You don't need a prescription to boil cumin water or apply it as a conditioner. You just need to remember what your grandmother knew. That's the strength of tradition. It keeps working, even after we forget why it worked in the first place.
That reminds me of something I heard from a patient. If it didn't come from a bottle, I didn't think it counted.
It's a mindset we've absorbed, often without realizing. But your body doesn't recognize branding. It recognizes nourishment.
There's something empowering about that, to know that what's in your kitchen might actually be more healing than what's in your cabinet. And for seniors dealing with dry, dull, or thinning hair, applying something as gentle as cumin or rice water can restore a sense of control. Let's look at that next. How rice water, especially when fermented, can revive tired strands and lock in softness without chemicals.
Fermented rice water is one of the oldest remedies for hair, and it works because it transforms simple starch into a nourishing tonic. The fermentation process releases amino acids, antioxidants, and minerals, all of which help strengthen hair fibers and soothe the scalp. It's especially valuable for older adults whose hair has become more porous, brittle, or prone to frizz. Even using it as a rinse just twice a week can restore softness, reduce split ends, and create a natural shine that synthetic conditioners can't match.
That's incredible. And frankly, It's something I almost never hear discussed in clinical settings. Most patients are handed another bottle of conditioner or told to use less heat, but not taught how to rebuild hair from the roots. Do you think the loss of cultural knowledge, like how to prepare and store rice water, has made us dependent on products we don't actually need?
Without any question, John. When we stopped making things ourselves, we stopped understanding what real nourishment looks like. Boiling or fermenting rice water isn't just about results. It's about reconnecting with the process of care. And in aging, that relationship with your own body becomes even more important. Exactly. And the body responds to that kind of care. Not with miracles, but with consistency, balance, and resilience. Dermarolling works because the body is designed to heal, and when used properly, this tool taps into that natural intelligence. By creating tiny, controlled micro-injuries on the scalp, it signals the body to send blood, nutrients, and repair factors directly to the hair follicles. For seniors, especially those with thinning at the crown or temples, it can reawaken areas that have gone dormant, but it must be used gently with precision. Too much force or poor hygiene can do more harm than good.
It's not just about the hair. It's about remembering how to care for ourselves in small, quiet ways.
Exactly. And the body responds to that kind of care, not with miracles, but with consistency, balance, and resilience.
There's so much wisdom in that. For many seniors, the idea of standing over a stove, brewing something for their hair might seem outdated, but in reality, it's one of the most future-proof things they could do. Now, there's one more piece to all this: the surprising science behind dermarolling and why gentle micro-trauma may actually help revive thinning areas. Let's explore that.
Dermarolling works because the body is designed to heal. And when used properly, this tool taps into that natural intelligence. By creating tiny, controlled micro-injuries on the scalp, it signals the body to send blood, nutrients, and repair factors directly to the hair follicles. For seniors, especially those with thinning at the crown or temples, it can reawaken areas that have gone dormant, but it must be used gently with precision. Too much force or poor hygiene can do more harm than good.
It's a delicate balance, the idea that a little damage can actually bring growth. I've had patients who were skeptical at first, but once they followed a routine and paired it with natural oils, they were shocked at the results. Do you think this method is safe enough for older adults to try at home, or should it always be supervised?
If someone is healthy, attentive, and uses the right size, usually 0.25 to 0.5 millimeters, it can be done safely at home, but never on inflamed, irritated, or infected skin, and always with clean tools and clean hands. The key is to start small, listen to your body, and never push through pain.
Listen to your body part is what most people forget.
Exactly. Healing happens in response to care, not punishment, and the moment it becomes painful or aggressive, we've crossed the line from the therapy into trauma.
That's such a powerful point. What I love about this approach, whether it's cumin, rice water, or dermarolling, is that none of it is about fighting the body. It's about working with it, gently, patiently, and with respect. Now, for those wondering where to begin, let's pull everything together: the 4 core causes and how to begin healing from the inside out.
When it comes to reversing hair problems in seniors, the starting point is rarely the scalp, it's the blood. Low levels of vitamin D3, iron, ferritin, and even B12 create a nutrient drought, and the hair is one of the first to suffer. But here's what many miss. Labs might show normal values, but what's normal on paper may still be insufficient for regrowth. Especially in older adults, We need to aim for optimal, not just acceptable.
That really challenges the way we interpret tests. I've seen patients be told, "Your iron's fine," even when they're losing hair by the handful and sleeping 10 hours a day. Do you recommend retesting or asking for specific markers like ferritin or active B12?
Yes, ferritin especially is key. If it's under 50, hair growth often slows or stops. And with vitamin D3, I like to see levels between 60 and 80 for seniors with chronic thinning. We're not treating numbers, we are supporting systems.
That makes it feel so much more precise and hopeful.
It is hopeful because once these levels are corrected, hair often responds without needing anything extreme. The body wants to repair. It just needs the raw materials.
That's a refreshing perspective, especially for those who feel like they've tried everything. Maybe the truth is, they haven't been missing treatments, they've been missing answers. Let's finish by laying out the 4 key mistakes most people make, and how to finally approach hair care with clarity and confidence.
One of the biggest mistakes I see is focusing only on the hair strand rather than the scalp beneath it. The scalp is skin, living, breathing, and responsive, yet most people ignore its condition entirely. Dryness, buildup, poor circulation, these block nutrients from reaching the follicle, no matter how expensive your shampoo is. That's why massage, gentle oils and ingredients like tea tree or coconut oil can make such a difference, not because they're magic, but because they restore balance to the skin itself.
That explains why some people see more results from 5 minutes of scalp massage than months of topical treatments. I've always believed that touch, circulation, and attention matter, but we don't teach people how to care for their scalp like we do their face. Do you think regular scalp care should become part of daily hygiene, especially in older adults?
Without a doubt. In seniors, circulation naturally slows, so stimulation becomes even more important, and it doesn't have to be complicated. Even a warm towel, compress, or soft brushing can wake up the skin and follicles. Think of it as giving the scalp permission to breathe again.
That's such a human way to look at it.
We forget that the scalp isn't dead. It responds to care, just like any part of us. It just needs consistency, not perfection.
And maybe that's the real takeaway. Healing the hair isn't about fixing something broken, it's about nurturing something neglected. If we can shift that mindset, then the tools, cumin, rice water, dermarollers, nutrition, become less like treatments and more like rituals of care. So let's close this conversation by recapping the steps that actually matter, and the myths we can finally leave behind.
What I hope people take away is that hair changes are never just surface level. They're signals that something deeper might need attention or that the body simply needs more support. And the beauty of aging is that we still have the ability to respond with wisdom, not panic.
That's exactly it. This isn't about chasing youth. It's about honoring the body at every stage. From cumin and rice water to dermarolling and nutrient correction, we've seen that small steps really can shift the trajectory. And before we go, I'd love to ask you, if you could leave our listeners with one sentence to carry with them, what would it be? Something they could remember every time they look in the mirror and wonder, why is my hair changing?
Your hair isn't betraying you, it's just trying to speak. And if you listen gently, you'll always know what to do next.
That's beautifully said. To those listening, your hair isn't a vanity issue, it's a vitality issue. And if today's conversation helped you feel even one step closer to understanding your body, we'd love to hear from you. Take care of your scalp, your body, and most of all, your peace. And we'll see you next time on the Senior Health Podcast.